Welcome to the Senior Rehab Podcast.
The podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello, friends. Welcome to the Senior Rehab Podcast. Thank you for listening. I'm very excited for you to meet Dr. Bill Thomas. He is a medical doctor, a geriatrician, a farmer, an author, a musician, a teacher, and an all-around entrepreneur. He wears many hats, but all of them are working towards fighting ageism. He's challenging the status quo when it comes to the older adult conversation, and he does it in many ways, whether it's through books, whether it's through entertaining tours that he is on now, videos, blogging, speaking, whatever. I mean, he's doing it all, and he has some amazing things to say that will challenge you in how you perceive your patients. I know it did for me, at least. So I know you'll enjoy this. I am excited for you to meet Dr. Bill Thomas. Dr. Bill Thomas, welcome to the Senior Rehab Podcast. I appreciate your time this afternoon.
Thanks for having me on, Dustin.
All right. So I heard of you through Ashton Applewhite, author of This Chair Rocks. She had some amazing things to say about you and said I had to get you on. So here we are. But I want to start off our conversation with asking you, if someone asks you, what do you do? How do you respond to that question?
Well, basically, I would say that I fight for elderhood.
All right.
I'm a person who's really passionate about life after adulthood, and I think that we need a new kind of elderhood in American society.
So, you're a physician, a medical doctor. When did this passion begin for you in your career?
Well, interestingly, when I was in medical school, I never even stepped foot in a nursing home.
Yeah.
In residency, going on rounds in nursing homes was my least favorite thing. I actually I did a residency in family medicine, but really loved emergency medicine.
Yeah.
And I thought I would never have anything to do with geriatrics, but it wasn't until I was out in practice that I took a part-time job in a nursing home as a medical director and really wound up falling in love with it.
That's wild. So were you in the family medicine residency hoping to pursue emergency? Was this prior to emergency medicine specific?
No, I was training in family medicine and spending a lot of time sort of moonlighting in ERs and having a great time.
Wow. So what was it about that nursing home in terms of, you became the medical director. When you stepped into that place, what was it that got you hooked, that really changed your perceptions?
Well, the thing that got me hooked was of course, and like a lot of people listening to the podcast, the people. I mean, it's all about the people. It's all about the relationships. And it's all about the fact that working with elders and people who love elders just gives you so many opportunities to make the world a better place. And so I never liked and still don't like the system.
Yeah.
I think the system is bad. Yeah. But I do love the people. And fortunately, I've been able to clarify that distinction in my own mind and always keep in mind that the people are great.
Yeah. I hear that. I'm only 4 or 5 years out of school, and I'm starting to have some of the same sentiments. So in terms of frustrations with the system. In your job, from the physician perspective, what were some of the most challenging aspects or frustrating aspects of being the medical director in that nursing home?
Well, I think number one was the constant battle related to polypharmacy. No matter what I did to try to bring reason and logic into the medical regimen of people, anytime they had any contact with the outside world, medically speaking, oh, wow, man, they'd come back with just, and we'd have to start all over again. So I feel like polypharmacy is fundamentally a confusion of care and treatment. People really want and deserve care, absolutely. And what they wind up getting in place of care is very often excessive medical treatment.
Yeah, I definitely see that on my end when I fill out an OASIS start of care form and do the medical profile, and 20, 25 medications, easy.
I'll tell you a quick story, Dustin.
Yeah.
I also taught medical students for a long time. And I always tried to, how can I get these med students to sort of feel, that polypharmacy is a problem? And I came up with this idea. I started collecting medical regimens like you do on OASIS.
Yeah.
Just, here's one, 19 meds, 18 meds, 22 meds. I collected a bunch of them. And when I started my clerkship with my students, I would hand each student at the beginning a medical regimen. And I would say, during this month, you're going to be taking these medications. And they would all be like, because I'm a professor, but they'd all be like, Dr. Thomas, if we do that, we'll get sick. And I'm so like,
true.
Yeah, that's true, isn't it?
Right. Or they couldn't even understand the directions.
I know. Or all of a sudden, the drug interactions and the side effects would be intensely interesting.
Yeah. And that's good to hear from your perspective.
I think that's what happens, Yeah, go ahead, Dustin.
Well, sorry. That's really good to hear from your perspective, because I know, I've worked a little bit in the nursing home, and you see some of these medical these medication lists, and it's very easy just from the PT standpoint to get somewhat frustrated with the physician. But to know that even you overseeing that building, you are still battling with other physicians as well. So to know it's not just that one physician.
Let's face it, and doctors are given an abundance of training on how to start medications. And no training on how to stop them. And so what happens? We know what happens.
Yeah.
What happens is a lot of medicines get started and not many get stopped.
Yeah.
That's what we deal with.
Yeah, that reminds me of Dr. Mark Cuckoos. He's a family practice physician in the Eastern Panhandle of West Virginia, and he is working to take people off of insulin, and sometimes while they're still in the hospital, because he'll do some shifts in the inpatient setting.
Sure.
And it's amazing the resistance that he has gotten in trying to develop a protocol to reduce the medication. But he's doing some awesome work. But it was that lesson that you just mentioned was very obvious in talking with him. So. You had this experience, working in the nursing home, transformed kind of how you view older adults. So if you kind of look at the healthcare, I wouldn't say the system, but many of the providers that you see, whether they're physicians, PAs, nurses, therapy staff, what do you perceive are some of the biggest lessons that we need to learn in this day and age in terms of taking care of older adults?
Well, I think a few things that really come to my mind, and physical therapists are already dialed in a really great way. In that, a couple of things. One, older people are astonishingly healthy. They're amazingly healthy creatures. They're the people who lived a long time being very healthy. So even if we encounter an older person who's having ill health, you have to look at that person and go, this person has been healthy for 85 years.
That is impressive when you frame it like that.
Oh, my goodness. Yeah. This is among the world's champions at living in being healthy. So I like to remember that. And so that we don't distort the filter and think, oh, well, old people are weak and sick and frail.
Yeah.
Actually, statistically speaking, they're really remarkable specimens, older people, and deserving of of the prestige of being healthy for a long time.
Yeah.
I think second thing is, and again, physical therapists are there. I think the second thing is that there's a really powerful tendency to focus on deficit. And I understand why, and a geriatrician, but to concentrate on deficit and to sometimes lose track of strength.
Yeah.
Now, I'm saying this to a bunch of physical therapists who are wired into strength. I mean, I know you guys are.
Yeah. Well, don't assume. That's
okay.
Don't assume.
Well,
but yeah, I hear you.
It's one of the things I love about physical therapy.
Yeah.
So, so let's build on that. As I guess what I would say is, everybody is presenting you with a bundle of strengths, a bundle of capacities, a bundle of reserve, and it's really our job to figure out how to configure those strengths in such a way as to help this person find well-being. One thing I spend a lot of time talking to people about is properly understanding the meaning of healing. A lot of people confuse healing and think that healing is somehow getting back to the way it was before.
Yeah.
That's not a helpful frame for healing. Healing is actually much more about finding a new normal, and finding a new normal that works for you, and finding a new normal that delivers well-being and happiness. And the new normal isn't going to be like the old normal. Or very rarely is it like the old normal.
Yeah.
So finding the new normal and making peace with it, and making sure that this new normal offers access to joy and connectedness and happiness, that's healing. Yeah. And I think at its best, physical therapy has a very good bead on that.
Yeah. I like that, the new normal, and something that I've noticed and heard from several other people is that as kind of the generations transition, and I haven't really perceived this because I've only been practicing for 4 to 5 years, but just to see how that new normal, how much variability that is amongst older adults, just based on the lives that they've lived and just kind of the condition that they are in, but then also to see some of these older adults that their normal may be deadlifting 200 and some pounds.
Yeah, right.
And just to really think that new normal, after injury or just with aging, of just what is that for that person? Because I
for
feel
that
like,
person.
Yeah, I feel like for me, it's easy to think that new normal for that age group, which may work for 18 to 20-year-old, but not necessarily for the 80 to 90-year-old. But that is helpful, because it is easy to think of healing as kind of back to the textbook standards, as we like to think, for sure.
Yeah. If I can throw out one more thing.
Yeah.
You're raising a point which I is completely accurate, and I would translate it into sort of the language of gerontology, which is age endows populations of older people with polymorphism.
Okay.
And what that means is, when we're very young, we are very much like people our age. So kindergartners are almost all 4 years old, almost all 40 pounds, almost all 40 inches tall.
Yeah.
Okay. They're very little, small amounts of variability. 84-year-olds have astonishing levels of variability between one 84-year-old and another 84-year-old. So a system that delights in making rules for everyone fails when it encounters older people, because you just can't do that, because the people are not the same.
Yeah, that's a good point. That sounds so much smarter. Polymorphism. Thank you for that.
Well, see, that's what's nice. You can now throw that down on people.
Yes, I need that. I'm from West Virginia, and I don't have too many multi-syllable words in my dispense, so I'm gonna put that one in my back pocket for sure. I'm interested to hear, and you can be frank, be real with us. When you were you were the director of that nursing home, what were some of your frustrations in terms of the therapy staff? So not just PTs, but OTs and speech. Were there any things that you wish we did differently or better?
The number one issue I have had, and you alluded to it. I mean, and if you asked me to be really direct about it, I too often hear people talking about their work as a strategy of compensation for losses. That our job is to help older people compensate for losses. And I mean, it seems like, well, how could you argue with that? Obviously, that's what we do. We help people compensate for losses. And there is indeed some of that. I get it. But the framing is bad. Because even if you say, I take a strengths-based approach to compensating for losses, I tend to look with a lot of respect to what advocates for young children have done in framing the debate and the intervention and our interaction with very young people around growth, around development, around how do I help this person get growing again, And the thing I like about that is that this compensating for losses is ultimately a backward-looking perspective. And remember too, you asked me to sort of isolate a concern, and I know a lot of people are listening and saying, "Well, I don't do that." I get that, but if we think about this for a minute, it also becomes clear that that our language often embodies declinist framing or ageist assumptions. And I'm not blaming individuals like we said at the beginning. I'm blaming a system and a culture that diminishes older people.
And honestly, that's pretty accurate in terms of if we look at the norm of, I can only speak for physical therapy, but this podcast has really grown out of the frustration of the lack of, I guess, of growing people's abilities, of seeing older adults and seeing that they can improve, that we can challenge them, they can adapt, and we can improve their quality of life within, the constraints of the situation that we're in. But the norm is definitely compensation for losses that we under challenge the patients as well.
Yes.
So
can I just say, so if you have that, if we arrive on the scene with assumptions about limitations and weakness, people sometimes don't get the full benefit of what we have to offer.
Yes.
And I'm going to stand up and raise my hand and say, do I embody and transmit ageist assumptions in language? Yeah. I'm fighting it constantly. So I'm not offering a purist's point of view. I'm just arguing for greater, I would call it a higher level of consciousness about those issues.
And that's definitely something that Ashton Applewhite echoed as well when we talked to her. So let's transition a little bit. Tell us about the Greenhouse Project.
Well, it connects exactly to what we're talking about. For 50 years in America, the idea has been people living with frailty, once their needs are greater than what their family can provide in the home, must be subject to, in essence, mandatory institutionalization. And that for some reason our society has had this idea that institutionalization is the only tool that can address the needs of people who are frail. And that is, when you back up and look at it, utterly ridiculous. And the Greenhouse is really an attempt to say, actually, people who are living with frailty can and do thrive in a variety of settings, and can thrive in a setting of a shared household where a small number, say 8 to 10 elders, live together in a house, share a kitchen, each have a private room and a bathroom, share a big wooden table for meals, and are supported in the rhythm of daily life by people who are really committed to well-being. not committed primarily to task, but committed primarily to well-being. That's in essence the greenhouse idea, and it was intended to strike a blow against the epidemic of institutionalization and to drive people to new ways of thinking that are much more community-based, much more home-focused, and much less institution-oriented.
Yeah. And for those listening, links to this will definitely be in the show notes, thegreenhouseproject.org. And the website is just amazing to see what this actually is, what this looks like when it's executed. And I'm wondering if, say there's a physical therapist or OT or speech as well listening to this podcast, and they work kind of in the institute, in the skilled nursing facility.
Sure.
What is some of the low-hanging fruit that they can do in their own workplace that would mimic more of what you're talking about?
I think it's always, change always comes at the speed of conversation, really. And I think it's reading about, studying, and internalizing the vocabulary and the lexicon and the syntax of a strongly person-directed style of professional practice, and bringing that to work with you. Ultimately, let's face it, me, you, everybody, we can do podcasts and everything, and I do love that. But ultimately, our greatest influence is exercised in and around and with people with whom we have direct contact. And I will say to the PTs on the thing, if you're working in a place that you feel does not align with your personal values or ethics, then, think carefully about how long you want to stay there, because ultimately you're surrendering your life to people and organization that you don't believe in. So I'm a big believer in people choosing at every age. And so while we talk about giving more choice, putting more choice in the hands of elders, I also want people listening to the podcast also to live life with more choice. Yeah.
That's a good point. And the website is a great resource for that. I mean, just, earlier today I was going through and just looking at the pictures and reading the different testimonials, and the information you have on that site raises a lot of questions of how I interact with my patients and what I can do differently to bring in community, bring in that normalcy of life that they're used to, and not this life of isolation and kind of institutionalization. Like you mentioned. So you mentioned, doing podcasts and books and, all the awesome stuff that you've done with the Greenhouse Project. And that, that is a step in the right direction, but what I'm intrigued by is what you're up to now. I mean, it seems like you've done a little bit of everything, but this is by far the most unique thing I've seen in terms of talking about ageism in older adults. Could you tell us about the tour that
actually
you're on?
I've become a wandering minstrel. As you know, I've been traveling the country, going city to city to city, talking, performing, singing, playing, no dancing.
Oh, come on.
However, I have been really using theatrical tools and methods and actual live theaters for live performances dedicated to challenging the conventional wisdom around aging and challenging the assumptions we make. And we call it the Age of Disruption Tour. So if you're listening and you go to DrBillThomas.org, very simple, DrBillThomas.org, THOMAS. If you do that, you're going to see that we're probably going to be in a city not far from you at some point this year.
Right.
And we'd love to see you. We'd love to have you come up and say, "Oh yeah, I listened to Dustin's podcast." Would be great. Yeah.
Yeah, you all are definitely covering a large area of the country. Yeah, I would love to check that out personally. I love just your outside of the box thinking in terms of kind of addressing this issue in many modes, in many ways, and it's definitely generating a lot of discussion, obviously based on all your appearances in mainstream media and just getting a lot of attention. So kudos to you for doing that.
Thanks, man.
So let's wrap up. I want to be respectful of your time. I'm just going to ask a few quick questions.
Sure.
But your responses don't have to be quick by any means. First one, what would you tell the 25-year-old Bill Thomas, knowing what you know now?
If you look fear in the face, it will run away.
Wow.
I think a lot of us, takes a lot of us too long to learn that.
What were you afraid of?
Actually, early on, at that age, I felt I was very insecure in that I felt I needed to, get through training and get a job and settle down and lock it in. Like that's it. That's what I'm going to do. That's where I'm going to stay right here. And my younger self, ironically, was much more wary of change and challenge and new circumstances. Ironically, I dreamed of, getting through medical training and getting established in a practice, and that's it, 40 years. And now as an older person, I recognize much more that that was partly my own fear speaking, that I was actually projecting that image onto the world when the world actually is much more tolerant of change and new perspectives.
Yeah, that's good advice. What's been your kind of the most influential resource, book, or person that has influenced how you view aging?
This, would sound a little weird or not. I don't know. Probably the most influential book is by a woman named Jane Jacobs.
Okay.
She wrote a book called, the book's now probably 50 years old, but she wrote a book called The Death and Life of Great American Cities. And the book is a phenomenal read even today if you pick it up.
Yeah.
But the book really explored why cities live or die. And the answer that she determined in that book was that it all comes down to our success in fostering relationships. That a city, big, complex, is actually an intensely dense weave of human relationships. And I took from that the perspective that if I'm working in long-term care or a nursing home or assisted living or something, that it's actually the relationships that measure the worth and the value of the place, not the buildings.
Oh, preach
For
it.
example, she gives the example in the book of Boston's North End. Yeah, you've been there? So none of the Boston's North End could be built today. Not one bit of it. That's all violates codes right upside and down.
Yeah.
And that's what makes it beautiful, is because the way it was built fosters intense, you've been there, intense communal feelings. And there's a lot of eyes on the street and the cars can't move very fast because there's kids playing ball. You know the deal.
Yeah.
So the thing is that our culture, when we adopt these kind of one-size-fits-all rules, we kill cities. We suck the life out of elders who are living in long-term care. And that if I put my focus much more directly on relationships, I'd probably be more successful. So that's Jane Jacobs and why and how she had a big impact on me.
Yeah, I'll link that in the show notes. That made me think of one of the nursing homes I worked in was in the middle of nowhere, West Virginia. Romney, West Virginia, if anyone's ever heard of it. And I was there. I was just doing a 13-week commitment, and it was amazing. I walked into that place, and everybody knew everyone. I had patients that were roommates. They were in their 90s, and they knew each other since first grade, since grade school. They were talking about riding horses to elementary school together. And just the building was, I mean, it was a crapshoot. It was terrible, but everyone, I mean, it was literally family, and I was so excited to go into work Right. And then I think of some of the other places that I've been where it's very transient, and in terms of the staff, and then even, the people living there as well, just in and out, in and out. It was terrible. And I think that really embodies that. So, all right. So last question here. Let's say you are at a rehab conference. You have every geriatric rehab clinician in the room, and you've already given us a lot of wisdom today, but what is one thing that you would make sure we know?
I'd go back to what we were talking about at the top of the show, that if I could give them magic eyeglasses, in some sense, they would walk into the presence of the elder knowing that they're in the presence of a globally elite athlete who has maintained excellent health for, in some cases, 70, 80, 90 years. And, if you have an elite marathoner who has sprained his knee and is limping around, you're not like, oh man, you suck. You're like, this is incredible. Wow, you're an elite marathoner. No, you can't walk very well right now. But wow.
Yeah.
So I would say the same thing about elders. You might see somebody on a day when they're not at that same level, but they've got a world historic experience behind them in terms of their position as a long-lived human.
Yeah.
And I just like the joy and the feeling that comes with, in essence, working with world-class athletes every day. That's what you're doing when you're hanging out with elders.
I love that.
And they deserve the best.
Yeah.
So
preach it. I like it. Well, thank you, Dr. Bill Thomas, for your time and just your perspective and how you're so creative in talking about these issues and really stretching my mind a little bit and to ask questions about how I view and care for my patients. I know everyone listening will have the same thoughts. So people can find more about you at DrBillThomas.org as well as thegreenhouseproject.org. Are you active on Twitter by chance?
Oh, yeah. DrBillThomas.
Okay.
Is my handle.
All right. So people, ask him a question, tweet him. Let's keep this conversation going. Dr. Bill Thomas, I appreciate your time.
Cool beans, man. Catch ya.
Hit me. I appreciate you listening to the Senior Rehab Podcast. The show notes can be found at seniorrehabproject.com, as well as some other helpful services and products that are offered at a discounted rate to you, the amazing people that listen to the Senior Rehab Podcast. So, until next time, my friends, please do not forget to stay funky.